Hi guys, it's Dr. Denney over at Four Paws at Fulshear, and today Lindy and I are going to be chatting a little bit about dog dental care and dental disease and signs and symptoms to watch for, and also how we treat dog dental disease.
How does dental health impact the overall health of my dog?
So that's a great question, and I'm going to kind of draw some parallels between humans and dogs because we both have sets of teeth. Yay teeth. So with humans, the recommendations are to brush your teeth twice a day because it brushes the plaque, which is bacteria, like a bacterial biofilm, off the surface of your teeth. And if you don't, then that plaque turns into tartar, which is a little harder substance. And if you don't take care of that, then the plaque turns into something, or tartar turns into something called calculus, which is calcified tartar, which is very hard and has to be removed professionally. So I'm going to kind of preface that. So with dogs, dental care is super important because your mouth is what you eat with. So any kind of bacteria or pain or anything that's going on with your mouth is going to affect the rest of you. So if you have a lot of bacteria in your mouth and a lot of dental disease, then you may not eat as much because it may hurt, or that bacteria may circulate in your bloodstream, eating away at the dog's organs, hearts and liver and kidneys. You know, I've seen older dogs come in with really severe periodontal disease or dental disease, and when we send off lab work, we get the labs back and their liver and kidney values are struggling, and it's not uncommon to, when you do a dental, to see those values improve somewhat if the dental disease was a contributing factor.
Why is early detection and diagnosis of dental disease so important?
Oh, because it's way cheaper to fix before it's a big deal. It's way cheaper. There's a lot of work that goes into dental care and performing anesthetic dental procedures on our pets. It is much cheaper, easier on your wallet, and better for the pet to try to prevent all the things that can happen. So the veterinary dentists recommend brushing your dog or cat's teeth twice a day. I don't know about you, but we live on planet Earth, and my animals are not going to tolerate that. But if you can hit it a few times a week, that's going to do something. Making sure that we're doing like DoxyRobe oral care or OraVet oral care. There's chews and things that if you come in and we have an appointment, we can chat about and talk to you about what recommendations we have to help keep your dog's teeth to be happy and healthy longer. But early intervention is key. If we sit on it and wait, then that disease, that bacteria eats away at the tooth root and at the gum tissue. And you know, once we get to past a certain point, those teeth are now infected and diseased and have to be removed. And that's where we start talking about spending, we're making a very big financial investment in your pet to get those infected teeth done and to repair the bone if it's needed. So there's a lot that goes into it.
How often should my dog's teeth be checked?
So at your yearly annual exam, we are going to look at their teeth, and a veterinarian will make the recommendation on, hey, you know, we need to think about getting, you know, Fluffy's teeth cleaned because we're starting to get some buildup back here. It's much cheaper to get teeth cleaned before there's an issue because then we're not having to talk about tooth extractions or oral surgery or things like that. Other ways are if your dog gives you kisses. So I don't know about you, but I've got 2 out of my 3 dogs are big kiss monsters. Kiss, 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 kiss. And I've got to tell you that I am up close and personal with their breath, and I am very quick to notice if there is a smell coming from their mouths that I do not want on my face, and you might not want on your face. So if you notice that your dog's breath or halitosis smells really bad, pick the gum up, look at the teeth. You can tell nice, healthy white teeth like when they were a puppy versus green gunk covered teeth and like pussy roots. Like you can see those things. I'd also like to note that if your dog does have significant dental disease and they are big kissers, you may not want them licking your face because that does put you at risk for infection because it's transferring the bacteria in the dog's mouth onto your skin.
What is a professional dental cleaning like for a dog?
So it depends on the grade. So there's 4 grades of dental care, 1, 2, 3, 4, 1 being the least, 4 having the most work that needs to get done. But generally we will do, if the dog is older than 4 years of age, we recommend preoperative, we require preoperative lab work. If they're younger than 4 years of age, you don't have to do it. We do strongly recommend it because anytime you go under anesthesia, you want to make sure the organs can handle it. But that's your first step. Most of our patients are dropped off right at 8 a.m. and they have all their procedures in the morning. They go under anesthesia. We do dental x-rays where we take full mouth x-rays to look at the disease underneath the gum line. That helps us determine if any teeth need to be removed. It helps us determine if any teeth can be saved. So if there's a lot of disease on plaque and on the gum line, but the roots are still healthy and we can get the bacteria cleaned off and do an antibiotic filling, we're gonna be more likely to save the teeth. So dental x-rays are really important. If they need to have extractions, we do full dental nerve blocks. So much when you go to the dentist and they're sticking needles, if you have to have work done, we use lidocaine to completely numb. So it helps with anesthesia, it helps with post-operative pain control. You do really want to be conscious of pain control. If you've had dental work done yourself, you understand how painful this can be. So pain control is going to be a big thing that we really push here at Four Paws at Fulshear. I believe very strongly in pain control. After the teeth are extracted and the sockets are flushed, if any are needing to be removed, we will then either pack the sockets with antibiotics or bone graft if it's needed, if the infection's eaten away at the jawbone, and then we will suture those sockets closed. And then we go ahead and, depending on if they're going to get cold laser, which we recommend for any type of dental procedure, cold laser is a modality that we use before the dog wakes up. It decreases pain, inflammation, speeds healing. The studies on it are quite profound. You know, we recommend it for all kinds of conditions, but any surgery I think should get cold laser. It is optional, but it is something that does help with pain control. After the cold laser is performed, then the anesthesia is turned off. The pet is on 100% oxygen with their breathing tube for 5 minutes, and then we recover them, and then they get all bundled up and we keep them nice and warm. And then we call the owner when they're awake, remove their IV catheter because they are on IV fluids and full monitoring while they're under anesthesia, and then they go home that afternoon. And that's how a dental procedure usually goes. We keep in close contact with all of our clients. If you do speak to any people that currently go to Four Paws at Fulshear to have their pet's dental care done, they will tell you we are very responsive. We do a lot of text message updates, phone calls if necessary, because it is scary having your pet go under anesthesia. Thanks so much for joining us, guys, and stay tuned for our next video.